muitos lugares do mundo, muitas pessoas estão morrendo dessa doença. Aqui em São Gabriel da Cachoeira, estamos trabalhando para que esse vírus não se espalhe. Parentes, precisamos da colaboração de cada um de vocês. Fique em casa.
Então, Yaputaia, Belpeiará, Pepitará, Arepe, Comunidade, Tarupi, Maciaité.
Pode ficar indo para a feira, para o banco, para a lotérica, para outros setores, para a Bolsa Família, para cartão SUS, essas coisas. Tudo isso já está diminuindo já e não pode ficar na rua indo para o bar, para a festa, tudo está sendo fechado.
Hi, my name is Juliana Rader. I am an environmental journalist and I advise a network of 20 indigenous communicators called Waiuri Network. And I have been living for 3 years in São Gabriel da Cachoeira, which is considered the most indigenous city in Brazil, with 23 different ethnic groups and 90% of the population are indigenous. So now with the coronavirus pandemic, we have a huge challenge to communicate about health issues and how to avoid Covid-19 in different indigenous languages. In São Gabriel da Cachoeira, in addition to Portuguese, there are 4 indigenous languages, which is also official language in the city. The indigenous communicators are using the radio amateur to send information about the pandemic for 750 indigenous communities in the area, which is in the border of Brazil, Colombia, and Venezuela. So my job is to support, organize, and articulate communication and advocacy actions in partnership with the Rio Negro, which means Black River, Rio Negro Federation of Indigenous Organizations, called for IRNI, which is linked to Waiuri Network. The informations are in Portuguese and also Yanomami language, Baniwa language, Tucano, and Yangatu. And the young indigenous communicators, they are very engaged to inform the communities about the pandemic and about the importance of social isolation. And they send the news using the radio amateur, which is the most popular way to send and receive messages in remote areas in Amazon. Because the internet infrastructure is quite bad and only in the urban area is possible to use mobile phones with internet. In the most part of the communities, the only way to have information is using the radios. So the radio are very, very important to keep the indigenous population aware of the risks of coronavirus. So the communicators are inviting doctors, nurses, and indigenous leaders to speak on the radio to explain the serious situation and ask the indigenous people to stay at the communities and not to travel at all to urban areas.
Tarupi com a coronavírus.
Esse vírus que não tem cura.
Sometimes many families come together, traveling around 3-4 days from the communities in the boats to buy some products in the city, like agriculture tools, things to fish, and some food that they don't produce in the village, like salt, sugar, rice, beans. So we are asking people to stay at the communities and don't go at all to the city. And we are very concerned now because the first 2 COVID-19 cases were confirmed yesterday in São Gabriel da Cachoeira. We were doing many efforts to lock down São Gabriel, but unfortunately some people did not respect the city isolation and come to São Gabriel clandestinely. So Brazil Health Ministry confirmed on April 1st the first case of COVID-19 among indigenous people in the Amazon, raising concerns about the spread of the pandemic and its effects on native people. And now, around 27 days after this, the first 2 cases appears in São Gabriel. So there is an incredible risk that the virus is spread through the communities and cause a genocide. Like in case in the past of old epidemics such as other types of flu and meals. So we are very worried about this. So we know that indigenous peoples are more vulnerable to respiratory diseases, and in São Gabriel da Cachoeira there are not intensive care units. So if an indigenous person has a serious condition in COVID-19, it will need to be transferred to the city of Manaus, which is the capital of Amazonas. Manaus is 1,000 kilometers from São Gabriel, and the plane ride takes about 2 hours. But the serious problem is that the health system in Manaus has already collapsed. The funerary system also collapsed, and Manaus was the first city in Brazil to decree chaos in the health system. The state of Amazonas already has almost 4,000 confirmed cases of COVID-19 and 300 deaths. There are many unreported cases because there are few tests. Even frontline healthcare professionals are not being tested when they get sick. Many doctors and nurses are dying. Last week, indigenous of Baniwa people, he was an endemic agent. His name was Aldevan. He was also an indigenous rights and intellectual. He died of coronavirus infection last week. He only took the test when he was already very ill. So he was intubated, but he couldn't resist. So keeping indigenous communities informed of this very serious situation is extremely important, and indigenous communicators are doing this job. We also put a sound car around the urban part of São Gabriel and in the suburb areas so that the indigenous people can listen to the recommendations in the language to avoid the disease. It's also interesting that the indigenous understanding of the disease is different, so all information must be adapted and contextualized for the local culture. For example, when we talk about social distance, we use the word pirarucu. Pirarucu is a large fish that can be 2 meters long or more. So with that, the information is making sense within the indigenous Amazonian culture to talk about the isolation and to keep a safe distance among each other. The network of indigenous communicators needs support to continue the work. We are launching a campaign called Rio Negro We Take Care to receive donations from people who can help the indigenous people stay in their communities, and also help in the production of contents on the radio, in the use of sound cars, and in the help with food and fuel for communicators. We are working hard to prevent the coronavirus from spreading in São Gabriel da Cachoeira. Many efforts are being made now, but we have a serious problem today in Brazil, which our president, Jair Bolsonaro, is a far right-wing president who persecutes minorities in the country, such as indigenous people, black people, homosexuals, and also against women. He fired the health minister last week, who was doing a good job, and now he is trying to end our social isolation. He himself goes out on the streets without wearing a protective mask, and has already called the coronavirus the small flu, which is an absurd. We are very afraid that indigenous people will not be able to receive care as they are a long way from hospitals. For this reason, information is essential so they know the dangers and can stay in the communities in the Amazon. They are the defenders of the forest. They protect the planet's climate balance, and now the indigenous need to be supported to protect themselves from COVID-19. I, as a journalist and advisor to indigenous communicators, have been working with them to bring information to also draw the attention of the world and the press to the serious problems that indigenous people are going through in the Amazon. Brazil's social inequalities are very evident now. Communication, information, and transparency are essential for people to remain alive and healthy in the Amazon. So this is our job here. Thank you for the opportunity and invitation to tell a little bit about our work in São Gabriel da Cachoeira. Thank you.
Filhas, sem saúde nós não somos nada, parentes. Então, Estamos aqui vindo passar mensagens a todos vocês. Fiquem em casa, só saia se for necessário. Federação das Organizações Indígenas do Rio Negro, FOIRNE. Também temos apoio aí da Polícia Militar de São Gabriel da Cachoeira. Todos juntos entrando na campanha contra a Covid-19. Não vamos deixar os nossos familiares em risco. Só saia se puder. E vocês também, comerciantes, dê o álcool em gel, máscara para seus clientes. Então vou convidar aqui os colegas. Estamos aí